Hi, my name is Andy. I'm a GaliHealth ambassador and content writer for the companion app that focuses on IBD and community. And I have with me Dr. Paul Wischmeyer. He's a perioperative physician who specializes in nutrition, is a patient recovery advocate, researcher, speaker, and professor at Duke Medical School. And to top that, he is also an IBD patient, ostomate, athlete, and dad. Dr. Paul, is there anything I missed?
Nope, I think that's perfect. It's great to be here, and thanks for having me.
So I just want to kind of hit off with June was Body Confidence Month at GaliHealth, and according to your social media, it looks like you're passionate about health and fitness and wellness. As both an IBD patient and somebody in the healthcare field, why are these things important to you?
So I think my interests in this started long before I was in the healthcare field,
Hmm.
and I think probably like a lot of people that potentially are watching that have IBD, like we do. I got it as a child, and it was my first real experience with healthcare or ever being sick. I'd never even seen a hospital before. I'd never been sick with anything, and like so many people I know, this happens. Suddenly, I took an antibiotic and got a stomach ache and started to bleed every time I went to the bathroom. And I guess it was my freshman year of high
Hmm.
school, and had already been an athlete. Was a high school basketball and soccer player and goalie, and was living my life quite healthy and happy. And then suddenly this bleeding started and didn't stop. And over
Hmm.
this break of my freshman year of high school, went in to the doctor, and they did all the wonderful, awful tests that physicians seem to forget there's a patient on the other end of. And
Fair.
yeah, told me I had this disease and I was going to come into the hospital the next day, or that day actually, and I wasn't going to eat for 6 to 8 weeks, and I was going to be on TPN.
Hmm.
I said, "You're crazy. I have a basketball game next week, and that's not happening." And of course, that is what happened. Um, and so, that was my first real experience with it, and was on TP a long time, and was in the hospital for about 3 months, and my colon perforated, and so the story went from there. And that's when I had my first ostomy at 15. And well, what I realized really quickly was I wanted to go back to being the student and the athlete that I was, and so I really pushed hard to get better. But I don't think it became such a big part of my life.
Hmm.
Until later. I think at that point I realized I wanted to go into medicine because I thought the physicians that took care of me and many of the other IBD patients I saw really didn't care for them, and they really didn't have any thought about what we were going through or have interest in actually knowing what we were going through. We were sort of just jobs to be done and boxes to be checked. And
Hmm.
I thought there was, well, I can do this better. I mean, people should take better care of people than I think what we do a lot of times now. And that's what ultimately inspired me to go to medicine. Then I wanted to research better ways to treat the disease than the awful steroids and other drugs they give us that make us crazy and never made me better. And I think, unfortunately, that's true for too many people now still. But I think it really was driven home to me. I was doing research at the Mayo Clinic in college, and I was working for a surgeon on IBD and the role of nutrition in improving IBD, and ended up getting a bowel obstruction and was going to have surgery. And he
Hmm.
said to me after that surgery, and while I was working for him, he's like, Paul, you're kind of gaining some weight. You should be more fit and you should run more like I do. And I said, gosh, no one's ever told me I was kind of getting a little soft. And at 21, nobody wants to hear that. So as it turned out, I was going to need another surgery to have my ileal pouch removed before I went to medical school. But he wouldn't do it because he said, you won't be able to have kids and your abdomen's a scarred up mess, and nobody should be operating on you until you've had children and you're 40 years old. But, be-
Hmm.
but before I went to medical school, it was just really bad, and my pouch was infected all the time, as just I'm sure people have experienced. And but I heard that surge, and I started to run every day my senior year of college, and I ran every day and started lifting weights for a year, and then had that surgery, and it was supposed to take 12 hours, and there was a good 70%
Hmm.
chance I'd never have children. I sperm banked. I did the whole thing. I was really scared. And the surgery was done in 4 hours. And when he came to see me, I said, well, did you actually even do it? It's noon and I'm not supposed to be out till 5. And he said, I don't know what you've done for the last year, but your abdomen looked like it never had surgery before. He said there were no more scarring. It was nothing like it was a year ago. So whatever exercise or whatever thing you've been doing, keep doing it the rest of your life. And I've never stopped since.
Oh,
And I
it
think that's,
sounds,
yeah, I think that's
yeah.
what inspired me. Um,
Your story sounds very similar to kind of my own. So
yeah.
I was diagnosed at 13. I started having symptoms. Actually, I very well remember this. I started having symptoms after I ate my little brother's birthday cake when I was 12. Um, and I actually hid the fact that I was sick from everybody for almost a year before it got so bad that I actually had to go in for testing because I was scared because I didn't know what was happening and why these problems were coming. And I went in for the testing, and at 13, the doctor came out and he's like, "You have such textbook Crohn's disease that I want to take a picture of it and put it in medical journals for it," just because it was just all the symptoms I had. I could check all the boxes.
Yes.
And so I just kind of lived with it for a long time. And I had very similar experiences as yours, where, you have these caregivers that are, you're looking to for help, and they're not really providing what they need to patients. They kind of forget that there is a human on the other side of those needles and tubes and everything else. And so I went to nursing school to pursue nursing with the goal of being a nurse practitioner to kind of aid that chronic disease management for patients. And then when I was 22, I also had a more aggressive form of Crohn's come back. And so I had the ostomy surgery, and I spent 3 months in the hospital because of complications and paralytic ileus and all that fun stuff. And so after that surgery, I was really worried about my body image and just how I would perceive myself. Just because steroids always change everything. So you already have those issues anyway. And I told my now fiance at the time, I was like, "You need to make sure I work out every day because I want to have a better body after surgery than I did before and have more confidence afterwards." And that's kind of where my own journey has taken.
Yeah.
So it just seems very similar. It's nice to have the like-minded.
I know. I think it can really change what the disease does to your life and how you perceive yourself, and how others perceive your experience with it as well. And that's where a lot of my research has gone into the role of exercise and nutrition and helping patients like IBD patients prepare and recover from surgery.
And do you have any advice for people that may have had a recent surgery or have anxiety about an upcoming surgery?
For sure. One of the reasons I moved to Duke, I had been at University of Colorado and University of Chicago before I was at Duke, where I am now for the last 3 years, was to start a true exercise and nutrition program targeted at patients getting ready for surgery or recovering from surgery and other big illnesses. And we had this unique opportunity to do that here. And so we have a nutrition clinic that there's a registered dietitian that I partner with, and we see patients before and during and after surgery for nutrition. And then we have an exercise clinic as well, where we do Olympic fitness level testing, where we can tell patients exactly where to exercise, what heart rate, and exactly what structure. And we can prescribe exercise like we prescribe medicine, using the techniques that Olympic athletes do, that is to the level of the person coming to us. So we do people who are in their 80s and are very, unable to do very much, but we can still make things for them. And then we do young people too. And so, some general advice, right? I mean, I think one of the key things we know is that if you are about to have surgery, there's some really simple nutrition things you can do and things you can take that will significantly improve your recovery and reduce your risk of infection by as much as 40 or 50 or 60%.
Wow.
So there's these really great, and a couple of companies make them now, preoperative nutrition supplements. And I work with a lot of these companies, so I'll disclose that because they help us do research. We couldn't do without them. But Abbott makes a great one. Nestle makes one. We use a lot of the Abbott products because they help us with our research. And so, there's an Ensure Surgery, and there's some others that we use in our research that provide certain key nutrients, arginine, and other things that help the body prevent infection. Really remarkably, there's many thousands of patients studied, and these only cost a few dollars, and you take them for a week before surgery and a week after surgery, and they dramatically reduce the risk of infection. And then the other thing we do with a lot of IBD patients and other people having surgery is we use supplements that have a high protein content, and then often other muscle building things like HMB and other supplements that you can get over the counter that tons of athletes take and you can buy at the store. But these supplements come made with it already, so it's very easy. So there's HMB containing supplements that people can take for the month before surgery, we find really helpful, and then for the month or two after surgery. It's a little bit like what an athlete would do with their protein shakes, only we know there's certain nutrients that are more beneficial than others.
That's really interesting. Yeah, that's really interesting because I know that from at least our perspective as
Yeah.
nurses, we're always saying that, one day in the hospital is 1 week of recovery.
Yep.
And so having something, that you can continue on to give patients that protein boost and just that extra little bit of oomph that they need to get over this healing curve is
Yeah.
just really incredible now.
And then there's a list of supplements over probably 30 years. I worked through medical school as a personal trainer in a professional bodybuilding gym where I learned more about nutrition than in medical school would ever have taught me, that I've learned to take that have a lot of evidence behind them. And I'm happy to send those to anybody. I have an email I send to patients all over the world who are either recovering from ICU or surgery or contemplating surgery. And I'm happy to send that out if people want to message me on Facebook or Instagram or on any of these sites. There's a list of things that I take. And when I travel to give lectures and things, I take a separate suitcase just for my supplements, because there's about 15 different things I take every day to stay healthy. And people like us, people with IBD, we could have an obstruction or a flare at any time and end up having surgery tomorrow. And I probably have an obstruction about once every year or two. Some years worse than others. I was hospitalized last in 2014 for a good 6 months. So this is just part of our lives. And so every day is the day I'm preparing for surgery, because it could be tomorrow. And unfortunately for IBD patients and ostomy patients, this is often the life we lead, but we can lead a really healthy life if we prepare.
I think that's just a very key point with IBD in general, is that it's not about, changing everything. It's just preparing for the things that you can't change. And so just having your go bag or having your extra food or having like your map planned out to the bathrooms, whatever is needed, is very, very important. Because like you said, I plan for leaks everywhere. I carry a go bag that's as big as my purse almost to every location I go to for that. And then, oh, sorry about all those like blockages you have. That seems so much and takes a lot out of you.
That's the big part of my practice actually in the hospital. So I run the nutrition, the TPN service at Duke. I'm the supervisor of that service. And so it's an interesting day-to-day clinical practice when I'm not in the ICU and I'm doing nutrition, because almost all my patients are people just like you and I who have had the dread complications. So it's very easy to be empathetic, but it's also scary because you're watching what could happen. And of course, for many people it doesn't, but it's interesting and sometimes hard, I have to say. I really feel for these people, because you and I know what they're going through. They just have the worst of the complications, and we're stuck. Like, we have often been in the hospital for long periods of time, and so it's
I think one of the hardest things is when a treatment, like you've been through a treatment before that a patient may be new to. One that comes to mind is like putting an NG tube in, which for people that don't know, it's a tube that goes down your nose to your stomach. And it's not very small, it's pretty large. And when I'm going to set an NG tube on somebody, there's a lot of fear and just anxiety about having it and what it's going to feel like. And it's not pleasant, but you feel so much better after having it because of how it can decompress and remove some of this excess that may be building up. And it's just kind of translate that over to a patient or to anybody. It's like, don't let the anxiety of a treatment keep you from actually pursuing something that can make you feel better.
That's one of the joys. I am an anesthesiologist by training. And so I actually sedate people oftentimes who are really anxious for even NG tubes, really simple procedures that, I think a lot of healthcare providers take for granted, that for us are the memories that are the most stressful of our lives. I will often sedate I'll give them some midazolam or some other, one of the joys of being an anesthesiologist. That's one of the reasons I chose the profession. We take away suffering and pain. And I really feel like that's one of my most satisfying parts of my job is that the things that we suffered through, like the central lines come at our neck with the drape over our face, everybody takes for granted doing, but it's the most terrifying events of people like yours and my life, or in G2 the same. I sedate for those procedures, and I encourage my trainees and my residents to do the same. They don't realize what it's like until they've laid under that blue drape or had coming in their nose.
I think as healthcare workers, it's very important for anybody in our professions and that work with patients, is that it's maybe our 1000th time doing a procedure, but it's that patient's first experience.
Yes.
And so what can be routine day to day for us can be, like you said, extremely traumatic for somebody else.
The first day of their life, and it's just another day for us at work. But for them, every patient is potentially the worst, most challenging they've ever faced.
And just to continue on, do you feel like your education as a physician or in a medical field has prepared you for ostomy recovery and living, or do you feel like it's made it harder, or?
Um, I think there are things it has prepared me for. I mean, I think it gives you some insight.
Mm-hmm.
I hesitate to say it, but there's some days I feel like my experience as a patient far better prepared me for a lot of the things I do as a physician. Maybe I should have paid more attention to medical school. I don't know, but I often draw on experience, because I still think at the fundamental level, and I say this a lot in my posts, is that healthcare is about caring, right? I mean, the science is the science, and we're taught that, and it changes slowly, unfortunately, but the caring part's the critical piece, and I think that gets lost in all the facts and evidence and things that I think physicians think they're supposed to be great at. And so I feel like the caring pieces that I learned from the really good caregivers, who mostly were nurses and medical students, I have to say, are the people I really look back on that I felt like cared for me the most. The things I learned from them are the things I feel like maybe are the most important things I often do.
Yeah.
And it's hard to teach that. It's hard to replicate that, but we try.
It is. It's like we learn about, at least when I was in school, we learned about, having empathetic caring and active listening. And a lot of times it's like you said, it's having the experience as a patient has actually better prepared me for working as a nurse than what I learned in class. Because, in class, lecture goes in one ear and out the other. But then when somebody has an experience of it and you know what that's like, and somebody asks, like, hey, how do you know that? And it's like, oh, my friend did it or went through that,
So
because
true.
you lived through it. And so it just sticks in your memory so more acutely than anything a book or anything over a lecture could have taught you.
I feel like there's a lot of patients out there that could teach our students and our residents better than a lot of people I see posting things on Instagram and on Facebook. I feel like they post amazing thoughts and insights that I wish we could convey better to our trainees and our young doctors.
Very true. It's just coming in with a degree of humility. I feel like having lived experience gives you more humility, and also just a more unique perspective to truly relate to somebody else.
I think so.
I will say sometimes, like, having some medical background makes it a little easier when you know something's going wrong and you're just like, oh, this is not supposed to look this way or feel this way. I need to go get help. That's where it kind of came from for me. But do you find having an ostomy has made your overall quality of life better or easier? Or do you think there's some things ostomy living has made more difficult?
So, I had one for about a year at 15, and then I had an ileal pouch. And I remember being difficult at 15 because I had a loop ostomy. For all of you with loop ileostomies, those are rough, and I feel for you. The ends are much easier. And then my ileal pouch failed, and so at age 21 during college, I went back, and I had an ostomy ever since 21, so like 30 years now. When I had it done at 15, I couldn't wait for them to do it. I think when they came in and told me you're going to have surgery tomorrow, or you won't live through tomorrow night, I think they thought I was going to say no. And I said, God, can you do it now? And I immediately thought my life was better. I mean, I'd been in the hospital continuously from the day they diagnosed me, and was bleeding all the time, and had gotten 50 units of blood. And I really didn't think I was going to live through it. And so I was thrilled, I think, at that point, scared, because I think we all are, to have an ostomy, and I think insecure about it, and probably always will live with some insecurity about it. When I was 21, I begged them to do the ostomy when my ileal pouch was failing and infected all the time, and fistulizing and leaking. And, the ileal pouch is a great surgery. I don't want to discourage anyone from having it. I was the first male teenager in Chicago to have one. We have small pelvises as males, and the surgery's tough. It was a different kind of surgery back then than it is now. Now we staple it, and it used to be hand sewn. The stapling was much better. People do much better with it. So I would encourage everyone who's got the opportunity to do it. But mine didn't go well, and sometimes they don't. And I begged them to do the ostomy at 21, and my life was immensely better afterwards. I went from really struggling at times in school, my beginning of my junior year of college, because I was taking steroids again and having to put a catheter into my ileal pouch to get it to drain. And it was like being sick all over again. And I theoretically was cured because I had ulcerative colitis, and I shouldn't have been sick anymore, but that wasn't true. And so immediately everything got better, and school got easy. My life got easy. I realized, girls would still like me. And I mean, I think I was more worried of their perception. And there's clearly been people through my life and my dating life that maybe one or two actually out of my whole dating life that were a little shocked by it. And
Mm-hmm.
you know, those are people that I don't need to spend time with, right? But the
Exactly.
majority of everyone else, including the wonderful woman I'm married to now, they don't even seem to notice it, which is
Mm-hmm.
unbelievable. I don't know what your experience has been, but it's always blown me away that I notice it much more than they do. And so I think
Yes.
I've learned that I guess it's all in how you view it too, but I don't know. It's let me do things. It's never kept me from doing anything that I've wanted to do,
Mm-hmm.
as I would say. And I would never be able to do any of this if I didn't have it.
Yes.
I wouldn't
No,
be here.
my experience has been very much the same. Before surgery, it's one of those, I don't want surgery. I don't want surgery, anything but surgery. And then when I was hospitalized during this long time, I was on 120 milligrams of prednisone. It wasn't working. I looked
Yeah.
like a balloon. And the doctor came in and they're like, we can do, this loop surgery or some surgery first
Yeah.
to remove part of your colon, but you'll probably have to come back and do it again. And I looked at her and was like, I have not had a remission in 10 years. So I had total flare for 10 years. And I looked at her and was like, take the whole thing, just take it away. I don't need it. And I went and had my surgery. And despite having complications immediately post-op, that kept me from, having a more smooth healing process.
Yeah.
After that, I have felt so much better. I was able to complete my degree that was taking me 8 years to do. I was able to travel, do things that I've wanted to do. I even went to Kenya. It's like it never stopped me from doing anything. It let me have those opportunities that, I was too sick to do before. And then I was even talking to, it's like you said, I noticed it more than, other people. Like my fiance at the time, he went through the whole process with me. And he tells me now, he's like, I don't even remember what it was like when you didn't have one. It's just part of what you, like who you are. And so, when I wear clothes or something, I'm like, oh, do you see my bag through this? He's like, no, what are you talking about? And so it's definitely something that, because if you're feeling it and, you feel it under your clothes, it feels like it's much more visible than it is to everybody else. Because nobody else, I've never had somebody, even in the healthcare field, come up to me and say, hey, do you have an ostomy? Is that what's under there? That's just never happened. And I don't think it ever will happen.
Yeah, I think I have to say, I only joined Instagram recently, and the ostomy community on Instagram, their freedom in showing their pouches and being proud of them has made me better at doing it in the hospital. I see people having ostomy surgery almost every day I'm in the hospital. Mm-hmm. And now I've begun to openly show them all the time, because I want them to see, look, you can be healthy and fit, and no one would ever know you have it. None of them would ever know. But I said, look, I have this, and this is what it looks like, and I can wear normal clothes, and I can do normal things, and I can surf and run marathons and lift any. And I think the question I get a lot is can you lift weights? Can you exercise? Well, my abdomen never tolerate that. There's no amount of weight I can't have been able to lift in my life. I mean, I was a power lifter during my residency and could squat 600 pounds and deadlift 650. I mean, my abdomen worked fine, and I think other people's can too. And so people are always afraid, oh my gosh, you can do something terrible. You have to listen to your doctor's advice and make sure that you're ready and healed, but there's nothing you can't do. I've surfed and got smashed by surfboards, and nothing happens. It's just part of you that impervious, really. It's hard to believe that's true, but it is. And there's no exercise you can't do. And in some ways, I don't know, I feel like it makes it easier. We don't get bothered by some of the things other people do.
Yeah, I definitely relate to that. And then I wouldn't say go lift 600 pounds right away after surgery, but
no, I wouldn't say after surgery, but I'm saying that is not something beyond the range of someone after they've healed.
No, it's not out of the range.
There's nothing that's beyond.
Exactly. And I mean, sometimes it takes a little bit more, working around, be a little bit more innovative and creative in how you go about doing them. Like for me personally, doing any exercise that requires me to lay on my stomach, because that's where my bag is not very comfortable. But that doesn't mean I can't do those exercises. It's just you have to be creative, which I feel like if you have IBD, that's part of your repertoire of skills anyway. But yeah, there's no activity I've ever done, there's that where I couldn't do it. It was more just finding ways around how to do it best for me. I did try to swim in the ocean one time, and a wave hit me, and it completely separated my bag
Oh
while in
no. Oh,
Mexico. So in Mexico, so their changing facilities were not super great. And so I
I
came
bet.
out, I looked at Ivan, I was like, I need my bag. I'm gonna go to find this little ditch area over here, just watch my back for a little bit. But and it happens, and when you're in that moment, I think the anxiety leading up to those accidents, leading up to those moments, is way worse than the actual going through that moment. Because if you have the things you need, you're like, okay, this is the situation I'm in. I can get through this. This is no big deal.
Yeah.
It's like if you can get through surgery, then the
Yeah,
door's
you
all
definitely
open
get
for
through
you.
that. Yeah.
Hmm.
I mean, one of the things I think was one of the best choices I made is early on an ostomy nurse encouraged me to wear a belt because I was really active. And
Hmm.
so I always wear a belt, and I've used a couple different appliances now, but always wear a belt. And I think that's been hugely helpful. Like when I was
Hmm.
learning to surf, even, sometimes I would smash back onto the board and it would begin to peel the wafer back. But that belt,
Hmm.
even just the regular ostomy belt, I don't wear a stealth belt or one of those really heavy neoprens. I just wear the one that connects to the bag and the pouch.
Okay.
Um, it's never come off. It'll peel back sometimes, and so I sometimes have to add some extra tape to it. But
Hmm.
I have to say, yeah, the big waves in Hawaii and the ocean hitting it, I was terrified of it first, but now I've come to love it. It's one of my favorite things to do, and I'm not a very good server, so again, I'm always getting hit. But
Hmm.
but those kind of belts can make a huge difference if people aren't
Hmm.
wearing them. I wear mine 24/7, but a lot of people just wear them for activities, and so they're hugely helpful.
Yeah. Yeah, those I've tried those. Those are helpful. And even just the different kinds of bags, they're different styles.
Yes.
For me, for backpacking, the soft outlet one, it's kind of like a little spout almost, is
Yeah, that's neat.
life and day different for being able to, do the activities that you really enjoy.
Yeah, that's cool.
But before we get into it, unfortunately, I think we are kind of tight for time, so I just want to kind of start wrapping up. But before we do you have any kind of parting advice for anybody that is nervous about any sort of colorectal surgery?
I think just realize that, if it means getting past this disease, I have never met anyone in all the patients over 30 years now in healthcare that wasn't happy they had the surgeries they had. And
Hmm.
with IBD, now other illnesses may be different, but people who really had the difficult IBDs or cancers that were threatening their life, they all in the end seem to be really glad they did what they did. And so I think,
Hmm.
I used to counsel a lot of teenage kids who were considering it. And I encouraged all of them, if you have an opportunity to have surgery and they think it's time, have it. Your
Hmm.
your life will be better, and the disease always comes back. Um,
Hmm.
so for, and I watched it destroy so many lives of people who, hope for that next remission. And I just would encourage them to have it. And then the other piece that I'll comment on in this era of COVID, especially for those of us, having the illnesses that we have and having our short gut, stay hydrated. That's the one key thing to exercising that's different for us is water won't do it, right? It needs to be like, I use a lot of
Hmm.
Gatorade Zero, but you can use other drinks. You need more salt than other people. Getting dehydrated sets you up to be at risk for not just dehydration, but COVID itself probably, and other infections. So stay hydrated. And the other two things we're doing a lot of research on that I think help ostomates in general is probiotics. We're doing a lot of research on probiotics.
Hmm.
We're doing a big study right now. If anyone has a family member that gets COVID, or if you do and you want to protect your family member, we have a big study at Duke that we can enroll people in, and we'll send you everything you need right in your home. But I would encourage everybody, Lactobacillus GG is the probiotic we're studying, and I've studied in my lab for many years. We really think it can reduce
Hmm.
the chances of you getting COVID. And then get your vitamin D level normal. I would take somewhere between 2,000 and 5,000 of D3 a day. Most of the country's deficient, and that really sets people like you and I up for not just it affects our muscle fitness for one, but it affects our immune system greatly for another. And so I'd encourage
Hmm.
everybody, vitamin D, 2,000 to 5,000, and a good lactobacillus GG. Like we work with Culturelle, they're a good company we've done a lot of research with in the ICU, and they're the product we're using in our COVID studies. You can get it at Target. So, and they fund our research, so I'll disclose that, but that's because we wanted to work with them.
Yes,
So
and I'll add one little nursing bit to
I do,
that
please.
I've seen. If you smoke any kind of thing, whether it's hookah, cigarettes, marijuana, work very, very closely with your medical team and your providers, because any sort of smoke that you take into your lungs is wasting functioning of your lungs, and it can make it worse if you do contract COVID. So like Dr. Paul said, stay hydrated, try to cut that back on smoking. I understand medical marijuana, is a cure-all for a lot of people, or helps with a lot of people's symptoms, but do just work closely with your provider to make sure you keep those lungs functioning and clear as we can, because that will just help you in so many ways. And then Dr. Paul, good luck with your research endeavors, and please everyone remember to download the app in the iOS App Store and follow us and Dr. Paul on social media. And we would love to welcome you to the GaliHealth community.
Thank you.
Thank you so much for meeting with us.
Thanks for having me. Take care.